I've worked in healthcare for over 20 years. Now and I have a couple from working in nursing homes of seeing the figure in black shooting across the hall. And then in the next 24 hours a resident will die, and then in less than a week another one will pass as well. But my favorite story is this. I worked at a very small hospital, maybe 30 beds, that has been around for many years. In the basement is of course the old mange, and there is one elevator that goes from the basement to the main floor outside the nurses' station. This elevator would come up in the middle of the night randomly, and the doors would open, and all the staff would get up to go find the patient who just passed away. One night my coworkers and I were sitting at the nurses' station, and down the short hall to our right we heard this TV come on, and the volume is up as loud as it could go. One of my CWS and I walked down said hall to find the TV to turn it down. There is one room down that hall where maintenance has the door closed and do not enter signs on the door. After looking in all the open rooms, there is no other room but the closed one to look in. We open the door, and there is nothing in this room except the TV. I walked and turned the TV and said, "Stop that. There is a sick baby next door who needs to sleep, so please be quiet." I walked out and closed the door with no further incidents with the TV. During the OB section in clinical, I was placed in the nursery to observe what they did. Because it's a baby-friendly hospital, they don't routinely have healthy newborns back there, only newborns who require a little extra care but not yet NICU care. So most of the space is dedicated to desks, computers, etc., with a few exam rooms for mom-baby visits and one larger room for the isolates. There was a small bathroom in the back corner away from all the desks with an automatic faucet and paper towel dispenser that would turn on off all night long. It had gotten so bad that they just left regular folding towels on top of the dispenser because it would be triggered so much that it was becoming wasteful. Recently I had to sit as a BHM for a suicidal patient, not actually, just talked at the nursing home about how she would be better off dead because of her health situation. So I sat there in the dark room with only a little light from the door. Her call light TV remote was on the bedside table and she was snoring away. Her TV turned on, flipped channels a few times, and turned off all without sound BTW. So in that room I sat to the right of the door that hinged on the left. The door opened against the wall with the bathroom, and the barn-style bathroom door was open all night. In the bathroom there was a blue nightlight that was actually pretty bright. As I sat there was no way for a shadow from the hall to be cast into the bathroom, but I saw one moving around in there. I work in a trauma burn ICU. When I was on nights, had a patient go ballistic screaming about the dark men. We were trying to get her. Weird, as she was previously oriented, but maybe she was having a bad dream. Dropped dead during the day shift. Used to work ED in small rural hospital, and when transporting a patient up to the floor, the room right across from the elevator. And a little old man trying to figure out his TV button while up to the chair. Make a note to ask the nurses up there to help, and when I bring it up they say the patient in the room is female and on comfort care. She's a ward of the state and doesn't have any visitors. Charge takes a walk with me down the hall, and sure as shit there's no visitors in the room. Last one. When a curtain RT attending and I work, we are the deathly trio. At least one person codes, usually in room 27 or 43. So we're working, patient starts to circle in 27, when from the middle of the unit another nurse is yelling for help. She walked into her patient's room to find her with her subclavian line out, painting on the walls in blood to protect everyone from the shadow men. When my CAW tried talking her down, the patient saw one of the shadow people in the halls and lost her mind. Few minutes later we start coding the patient in 27 and were unable to get them back.